Hello, everyone, and welcome to today's HHS Town Hall. My name is Lucas Milonovich. I'm the Director of Urgent Ambulatory Care, and I have the privilege of standing in for Aaron Level today, who couldn't be with us on this Thursday, May 20th. We'll give some time for folks to start filtering in, and then we'll get started with today's Town Hall. So we'll get going today, and typically as we do, starting us off, will be Rob McIsaac, our CEO. Rob, over to you.
Thanks very much, Lucas, and thanks for jumping into the breach in Aaron's absence. I know you're going to do a great job today. And thanks to everyone else for tuning in again for our weekly town hall event. It's been another eventful week, giving us no shortage of items to go into today. I think the headline is that the numbers that we're seeing, both in terms of case counts, although of course things go up and down, but in broad terms the trends are looking like we have some cause for optimism. And similarly, in terms of our numbers in hospital, while they are I'll say stickier than what we're seeing with case counts, we are seeing some movements in the right direction. As a consequence of those trends, late yesterday we shared that the province has modified directive number 2, which was the directive telling us to ramp down surgeries and other procedures. That directive has been modified, enabling hospitals to resume services, although it's qualified that we have to do so in a manner, of course, that is safe and that is not putting undue pressure on inpatient resources and our ability to respond to the potential for further demands on our services as a result of the virus. So we already have teams at work determining a path forward that takes into account, of course, patient needs first and foremost, but also doing so in an equitable way, and while acknowledging that the pandemic could place ongoing demands on us. I think while we see that there will be some progress on the return of services in the upcoming weeks, the most prudent course of action is for us to do this in a gradual way. During this time, I think, in addition to many other factors, we are going to pay close attention to the needs of our workers. I want to give everybody who needs some time to recover from all that we've been through the opportunity to do that before asking people to dive into the next big task, which will be this giant backlog that's been created as a result of our service ramp down. So you'll hear more about this work today, and information about next steps will be communicated out to the enterprise on an ongoing basis. Also this week, you received communication in response to last week's provincial announcement regarding the acceleration of second doses for high-risk healthcare workers. So this is very good news that the government has made this possible for us. Between yesterday and today, many of you who are eligible for a second dose as a result of this new direction will have received a text or an email message with a new date and time for your second dose. We'll go over the details of this rollout a bit later in the presentation today. I do want to issue a sincere note of thanks to everybody who worked really hard to put this plan into place. When the province made the announcement that they were enabling this, that was purely a change in policy. It was not an implementation plan. And so we had a group of people who needed to work really hard on figuring out how we were going to make this happen in a timely way. So my sincere thanks to all of those folks who worked on this. As I do every week, I want to strongly encourage anyone who has not yet done so to please register for a vaccine as soon as possible. We've still got a ways to go before this third wave is behind us. And I think, we are very much at risk of a fourth wave if we become complacent about the pandemic or the virus or, its ability to impact all of us. Finally, before I hand the floor back to Lucas, I do want to make a special call out to Bruce Squires and the Children's Hospital for their efforts and their advocacy surrounding a safe reopening of schools in our province. This offer recently included an op-ed that was published in the Hamilton Spectator on May 15th. It's still available online, so I would encourage you to take the time to read it if you haven't yet. The pandemic has impacted so many different people, but the most vulnerable in our community are the most impacted, and children and youth have been very significantly affected by the pandemic. So thanks to all, including Bruce and his team, who are making kids a priority during this time. And as always, thanks everybody for coming today, and back to you, Lucas.
Perfect. Thanks so much, Rob, for getting us started. With that, next on the agenda will be an operational update, and I'll hand it over to Sharon Pearson, Executive Vice President, Clinical Operations and Chief Operating Officer. Sharon, over to you.
Great. Thanks very much, Lucas, and good afternoon almost to everyone. Just a few comments for the operational update today. And last week, we noted that the out-of-region transfers were moderating somewhat as the volumes have come down, and we did see that this week. So this is quite similar to the number that I updated on last week, was the 268 out-of-region transfers that came into the HNHB, and the total number for HHS remains at 88. As far as our current COVID capacity goes, there's currently 43 patients in our ICUs with COVID or COVID-related illness. And on the wards, there are 32. So I'll just remind everyone, we did open 38 beds across our adult ICUs in efforts to support the critical needs, the ICU needs of COVID. So we have 43 patients in those 38 beds. And then we have the remaining numbers that you can see there, the 32 on the ward. That's far less than our planning for 15%. And again, many numbers I know I throw out there in these calls, but we are planning upwards of 160 beds through our COVID peak for our 15% capacity. So we really have seen those ward numbers come down. Because we still have that ongoing pressure in our critical care areas, those 38 beds will remain open and sit above our normal complement. And the last comment I'd make is that almost 80%, 70 to 80, I would say, of the patients in the ICU are out of region transfers as well. So we have work to do with our partners looking to repeat those patients when the time is appropriate. If we go on to the next slide. In terms of the outbreaks, a similar situation to last week, and we have two outbreaks at the current time at JH and St. Peter's. And again, the ongoing work in the post-acute care can't minimize the amount of work that's happening outside the walls of the hospital to support the continual flow of patients across the sectors. Home and community care working very hard to really maximize the capacity within long-term care right now. We've seen incredible movement within our own facility of ALC, seeing numbers below 120, and again, was not unusual for us to be above 200. So really has been a significant drop, and that 120 includes the patients that we have at the satellite health facility. In order to manage the capacity that we still need to maintain, and that includes those 38 ICU beds and the ward beds, we still require the 240 staff that we have redeployed currently. We are anxious to have those staff return to their various programs and departments and services, and certainly looking at a plan that will help us get to that point. But right now, we still need to maintain status quo as we continue to watch and monitor what will happen with our COVID numbers. If we go to the next slide, Rob mentioned that we did get the directive yesterday from the Chief Medical Officer of the province around our surgical and procedural work and some support to reopen in a very moderated, gradual way. Our services that have been ramped down. The specifics around that are that we would first be looking at ramp up of services that do not require inpatient resources, so a bed. We would be looking at outpatient services. And again, we need to couple that with what staff can be released to support the OR work. And as we've mentioned before, the redeployment staff includes staff deployed from the ORs along with ambulatory care, EPIC, and other areas of the organization. There is planning underway. We have a group that will look at this and are looking at the process for ramp up using the same ramp down principles and assumptions. And again, very important that we emphasize that we need to look at wait times. We need to look at the implications of those procedures, surgical and otherwise, that will continue to be delayed. And we need to look at this through an equity lens as well. So we will continue to keep people updated on the status of the work and the resumption of that work. And just next slide. And then lastly, as we continue to update on the mobile health unit, it's come along very well. We are and continue to be on track should we need the mobile health unit, looking very unlikely that we will ever use it, but certainly has been a value to see it there. As we think about what could have been the trajectory of COVID. Sunnybrook are down to one patient in their MHU. And again, we work with the province and with Ontario West in terms of planning for the future and the mobile health unit. And with that, I'll hand it back to you, Lucas.
Thank you, Sharon. Appreciate that very much. And next up will be Dr. Dominic Mertz, Medical Director, Infection Prevention and Control, who will update us with everything COVID related. Dominic, over to you.
Yeah, thanks, Lucas. I think I have some good and some mediocre news to share today. Let me put it that way. Let's start off with the national picture here from last week. And when you move to the next slide, you see some of the darker blue becomes a little lighter blue and the numbers come down. Canada is sitting at roughly 100 cases per 100,000 per week now. And as you see in the left lower hand corner, cases come down very quickly at the national level. The only province right now that continues to see an increase in cases over the last week is Manitoba, which now also has the highest rates with 227. All the other provinces are currently labeled with a green RT. So the trend has been coming down. Ontario slightly over the average, the Canadian average of 101 with 109 here. Also Nova Scotia is now coming down and seems to be post-peak down to 78 per 100,000 per week at this point. Next slide. That's the Ontario picture. We have been coming down very nicely over the last month, sitting now at just above 100, as I mentioned. So again, slightly lower than last week, and it's well possible that until the end of the week, we might be at 100 or even less than that. So things are certainly looking well at the provincial level at this point. Next slide. And this obviously translates into the healthcare sector as well, as already mentioned. The big red bars showing you number of confirmed active COVID-19 patients in the healthcare system, which came down from close to 2,500 at peak to now around 1,500. The darker red colored bars are the ICU cases, where we see less of a decrease, but we certainly see a decrease since the peak as well. And the same for those smaller bars, which are the vented patients, coming down slowly but steadily as well. Next slide. These are the modeling. This is the modeling from April 16th by the science table. There will be a new set today. I will show you the last set as well. April 16th was the one where people got very concerned about the model that you see in front of you, but thankfully we did much, much better than what was expected, and the stay-at-home order most certainly had an effect here, and we are continuing to head down, as I showed you before. The red, the red line here at the bottom is the actual data, and you see the 3 scenarios that have been painted back on April 16th. On the next slide, you see the following modeling, which was more optimistic, that came out on the 29th. Compared to that, we are somewhere between that green and orange scenario. Again, most certainly not, and not even close to the worst case scenario, with cases now coming down to a 2,000 daily average. We had 2 days below 2,000. Now today it's above 2,000. But when you compare to the last week, Thursday always tends to be the highest number, so don't get concerned about that. We have up and down throughout the week. Monday, Tuesdays typically be having the lowest numbers. Next slide, please. This is the ICU data again, first compared to the modeling from April 16th, which predicted in a best case scenario 1,500, worst case scenario 2,000 ICU beds by now. We are at 700. So again, things worked out much, much better than expected back then. On the next slide, you see the modeling from the 29th. And here we are pretty close, I would say, to the best case scenario. But the decrease that we've seen in ICU beds that we need after being steeper first than predicted has plateaued off somehow, which for which people have multiple explanations. One certainly being the long care that some of the folks that are on the ICU require. There might be a tendency to move patients on non-invasive ventilation who used to be on the ward, now being moved to the ICU because there's a little bit more capacity there. But the ICU remains the bottleneck provincially as well as locally. Next slide. This is the Hamilton view, and that's the less optimistic, but nevertheless optimistic news, I would say. We are not coming down as quickly as the provincial average, not as quickly as Peel and Toronto and Durham and York currently, not as quickly as Niagara and Halton, but we are coming down. What we've seen over the last few days is a plateau. We did see that after the second wave as well. When you go back there to end of January, you would have seen at around 100 cases per day that we also plateaued for a certain time period, and then the decline continued. I think at this point the assumption is that's going to happen as well, but as discussed previously, from here on we are expecting locally a slower decrease in case numbers, but certainly with the uptick in vaccines and now even getting more vaccines than originally assumed, that certainly cases should not increase again. Next slide. That's my final slide in terms of hospital admissions locally within Hamilton. You see that nice drop here as well, from more than 160 at peak to still more than 100 within the city when you're looking at total numbers. And ICU, you also see a decrease, but again, not a significant decrease anymore when you compare this week to last week. So sort of a plateau or on the very slow decline at this point of time. Thank you very much. And yeah, maybe one last word. As people know, there will be new modeling coming out today and later in the day at 3. The province will let us know what or how the reopening framework will look like. So let's wait and see how this will look like in terms of metrics used, dates, what's the expectation in terms of vaccine rates. So a lot to learn and to digest later today. Thank you very much, and handing back to Lucas.
Thank you, Dominic. It's not often that good and mediocre descriptions are a cause for tentative celebration, but for sure, let's hope that we keep going in that way. Next up to provide a bit of an update around vaccines will be Bruce Squires, the Vice President of Women's and Children's Health. Bruce, over to you.
Thanks very much, Lucas. And yeah, let me take this opportunity to just to call out. Not everyone will know that that in fact Lucas has, with his team, really been the core leadership to the establishment and the operation of the HHS vaccination clinic at 293 Wellington, which was the inaugural clinic for Hamilton, and continues to anchor all those efforts. So let me just take this chance to really recognize and thank Lucas and the entire team that's worked on that. So again, want to start with the numbers, we hopefully you will have seen the press that has both announced, recognized the fact that Ontario has moved past 50% of adults having received at least one dose of a vaccination. And we've just passed that in Hamilton as well. The reason a little bit behind is because particularly Toronto and Peel have been targeted given the much higher rates of infection as hotspots. And so more of the provincial vaccine went there first, and that drove up those numbers as a populated area and as the priority. But as I said, we've reached 50% of our population. And I'll also note that the last 3 days have been, and really the last week, have seen record numbers of vaccinations given in Hamilton on a daily basis, exceeding 5,500 and approaching 6,000. And what that means is when we continue that, we essentially move at more than 1% of the adult population per day moving forward in vaccination. Now we know that likely will eventually start to slow as we get to the parts of the population that have a little bit perhaps less confidence in vaccination, and so maybe are more hesitant. Hence the reason for the HHS support of the This Is Our Shot campaign and our ongoing and continued advocacy in support of and encouragement of vaccination for everyone in the population, including, as Rob started out, for each of our team members who maybe haven't yet decided to take that step, but you're very, very much encouraged to do so. Not shown, well, sorry, shown on here. Big new step is the province made the decision to this week, 1 week ahead of schedule, move to opening eligibility to everyone over the age of 18. What that means, of course, is that individuals from across the province can book through the provincial vaccine appointment booking system, either online or by phone into any of the clinics that are available and to any available appointment spots. That doesn't, of course, mean that everyone can get one today. You may have to book your appointment out in the weeks, and it will take a little bit longer to get through all of that population. But again, the numbers would suggest the combination of the supply that we understand we're receiving and the rate of vaccination to date, that Hamilton will be approaching the ability to have vaccinated 75% of our adult population by late June. And so that is, again, a really, really big step. The other thing that's new is the province's announced plan, and I did speak to this a little bit last week, to begin vaccinating 12 to 17-year-olds using the Pfizer vaccine as the vaccine that has been approved. Let's go to the next slide, please. HHS, again, has really been on this from the very start and at our 293 Wellington site. This week, we've stepped up and met the call from the city. We had an additional 8,000 Moderna doses come available, and so in an effort and an ability to get those into arms as quickly as possible, we have pivoted to convert the urgent care center, the West End Clinic, into the vaccine clinic for this long weekend. So for Saturday, Sunday, and Monday. This means that the assessment center will need to be temporarily closed for that period of time. From a public access to assessment, there were no appointments booked for this weekend, and there remains a very significant capacity across the city. As it relates to access to assessments and testing for our staff and physicians, that will continue to be available, and the process to contact employee health services and have that assessment visit booked remains the same over the weekend. It just won't happen at the UCC. Instead, it will be at a different site. Again, HHS also, we continue to be part of the Hamilton Health Partners, working to reach out, identify, reach out, and educate our patients and families, particularly those with health conditions. And our teams have had materials to support that for several weeks now. And we work with public health to make sure that we plan our vaccination clinics appropriately to do our very best to reach the public with first and second doses. And that ongoing process with our inpatients to mobilize the clinics, particularly for those going to long-term care or to other facilities, is well established now with a weekly roll through our adult sites. Let's move to the next slide, please. I mentioned the youth vaccination strategy targeting those 12 to 17 years of age. And there's a couple components to that. First of all, effective on May 31st, the province will open eligibility for that population to book appointments through the provincial vaccine appointment booking system, both online and telephones. As well, they've charged public health and school boards to work together to offer what they're calling family-friendly vaccination clinics at an intense way, designated way, that the weeks of June 14th and 21st. We're going to ensure, and McMaster Children's has been a significant part of working with public health to have a portion of those clinics focused on youth with high-risk health conditions, complex needs, other reasons, including needle anxiety, that may mean that those youth are best served by a really targeted clinic with additional supports. And so we're working together to establish that for the youth of the region. We're also charged and will be ensuring that there are indigenous vaccination sites that are again targeted to the youth from that community, mobily or with pop-ups, as well as with our Black and racialized youth in the community as well. Now, these plans, this was just announced in terms of the direction from the province, so the detailed work on those plans continues. And we will have more updates next week as at the town hall, as well as through communications out. Next slide, please. Rob also mentioned this significant step forward in terms of the direction from the province in response to the healthcare community to allow for a moving up, an acceleration of second doses for the highest risk group of healthcare workers. And as Rob described, a very significant team scrambled, worked all weekend to develop a process to implement this. And so that starts with text and email messages that are going out to those eligible. And it's been identified on the basis of the date for second dose, which would have aligned with the risk level. Those email and text notifications of a rescheduled second appointment are going out through today. And I'll talk in a second about the specifics around to whom it applies. But if an individual who believes they are eligible in those groups does not receive that text or email notification by the end of today, then starting tomorrow morning, they can contact a specific phone line, and it goes through the public health system, but then goes to a designated tree to have your second dose rescheduled. Because you attest that you are covered within that identified group of frontline roles. So the details with respect to this, again, were sent out through a memo back on Tuesday and are available on the hub. I do want to maybe highlight at this point, in response to some of the questions, that at this point, this is the only second dose acceleration beyond what was already available for a couple of health conditions and for residents in long-term care and retirement homes. This is the only acceleration of second doses that the province has yet permitted. We do think it's possible that there will be a point where the province adds additional groups and processes to the second dose acceleration. But at this point, this is far as they've allowed. This also bridges to a question around, well, what about AstraZeneca? And those of the community that may have received the first dose of AstraZeneca, which has now been suspended for any further first doses, what about their second dose, and how will they receive that? And by the way, we understand some AstraZeneca may expire. So what are we doing to ensure that that's used before it expires? And so this is a place where there, again, is a tremendous amount of discussion and I think advocacy to ensure that those second doses are used and that they aren't wasted before they expire. The province has been discussing this, and we are expecting a decision and guidance soon, but it has not yet come. So I don't have a further answer at this point to what about AstraZeneca and second doses. There's also questions when we talk about second doses, what about the mixing of vaccinations? So the mixing of vaccines, excuse me. And again, you know, there's emerging data and literature coming out with respect to that, and Dominic may choose to speak to it, or you may want Dominic to speak to it in our questions. At this point, again, the province has not yet made a decision, provided direction or guidance with respect to the mixing of vaccines between first and second doses, and then any guidance as to when and how that can occur. Again, point of significant discussion internationally, nationally, provincially, and so we may see something move forward on this relatively quickly. The last point on this slide that I'll highlight, we have in the last week initiated a voluntary questionnaire to all our staff and physicians, which invites you to voluntarily disclose your COVID vaccination status. And certainly you are able to disclose, yes, you have had it, no, you haven't had it. You're able to disclose that you're not going to disclose and make that choice. It does rest with you, but we encourage folks to consider this, because it can be very valuable in helping us to understand the actual level of coverage of our population. Let's go to the last slide. Just want to make sure that, again, folks know that there is a definition of the identified areas which are eligible for that accelerated second dose. as dictated by the province. They're set out in the or on the hub in the posting that we have there with detailed information. So I invite you to go there if you have any questions or comments. So I'm going to stop there. Lucas, a significant amount of information again. This continues to move, but I hope that's been helpful, and certainly happy to answer questions as they arise.
Thanks very much, Bruce. And, thank you to the panelists who have been diligently trying their best to answer questions as they have arrived in our chat box, or sorry, our Q&A. Again, just as a reminder, if you'd like to raise your hand, we can send you the invite to have you come online live. Otherwise, just ask that you keep it to one question per person. And again, if we don't get to your question today, and you specifically would like it to be followed up with, please do send it forward to hhsnews@hhsc.ca. Looking through the Q&A, I guess one thing that has been popping up a few instances has to do with the threat of spam emails and that being a point of contact. I don't know, Rob, maybe if you want to provide a bit of a suggestion of where those types of concerns should be directed. I know there's been some answers in our Q&A as well, but maybe just to provide some suggestions.
Yeah, of course, you can always consult with the person you report to, but if folks think they've gotten something that is spam, they can forward it to thisisspam@hhsc.ca, and our IT folks will check it out and assess the security threat associated with that. And just to be clear, we have not released anyone's personal health information, and nor are we aware of any breaches of that. So it may well be that somebody is pretending that they know more than they actually do. But in any event, if you've got something that looks questionable, please forward it to that. This is spam at hhsc.ca, and we'll look into it.
Thanks so much, Rob. And I know, Bruce, as you had mentioned during your portion of today's presentation, some questions around mixing of doses. I don't know, Dominic, maybe if there's some other insights that you might be able to provide around that.
Yeah, thanks, Lucas. Yeah, there were a couple of questions around mixing vaccines and shouldn't I wait now for the 4 months? And it's interesting to see those questions, because back in January, everyone was super concerned about having to delay the second dose, while most of us would have said, well, most likely you will have a stronger immune response eventually rather than a weaker immune response. But you have that window between the first and the second dose where you will not have the full protection as you will have from the second dose. So everything in terms of data that came out since basically shows that if you wait longer, 2, 3, 4 months after your first dose, your immune response as measured typically with antibodies tends to be stronger. So the way how you get out of your 2 vaccines may be better if you waited longer. Now the question is, well, should I wait now? Say I'm at the 2-month mark and I now get offered to get the second dose. Should I now wait for the 4 months? I would say no. If you have the opportunity to get your second shot now, get it now, because you need the maximum protection now while we still have a relatively high epidemiology, rather than 2 months from now when the case numbers are at least expected to be much, much lower than now. So please, if you qualify for the second dose, get it now. It's the right thing to do. If we learn along the way that the protection may not last as long if you had the second dose within a month or 2, then you may get a booster quicker than someone else. But again, now with the supply at hand, and we have the luxury to go ahead with the second dose, I would really like to motivate people to get out there, get the second dose now, aim for maximum protection now that we still have a relatively active COVID pandemic around us, and benefit from that additional protection over the weeks and months to come, rather than wait for the second dose. In terms of mixing the different vaccines, yes, again, there was always the assumption that you may have potentially a better protection when you mix and match. Is the evidence supportive to the extent that we would say, yes, make sure that you get a different vaccine for your second dose? Most definitely not. So again, get what you can get, and for people with Pfizer, this will be Pfizer. For people who had AstraZeneca, it may be a choice. We need to see and learn how that would look like, but just follow and get what you can get at this point, rather than asking yourself, well, should I do A or B? The difference we don't know whether the difference are clinically significant, but they may well not be. What you see in terms of antibody response doesn't translate one-to-one into protection. And with the 2 Pfizer doses, you're as close to 100% protected from severe disease. It's unlikely that this will be any better when you start mix or matching. Get what you can and get it as soon as you can.
Thanks very much, Dominic. Bruce, I wonder, I see you replying to some questions in the chat, but I do wonder if maybe for the purpose of everybody listening in today, if we could talk a bit about how some of the second doses that are being moved up, why they might be being moved to the First Ontario Centre location.
Yeah, absolutely, Lucas. Thanks very much. It's really a case of the fact that there were already appointments booked in, first dose appointments booked into the Wellington site for those dates, which are going to start around May 26th. So if we had tried to move these second doses into the Wellington site, we would have had to cancel and rebook twice the number of appointments. And so honestly, that just didn't make good logistical sense and would have been much more of a source of potential error and concern. So logistically, it was just more practical to move these second doses to the First Ontario site. I do want to highlight that those second doses will continue to be Pfizer. I know there was a question there, so you'll get the same second dose, and you may even get the same vaccinator, because our vaccinators are moving all across the sites of the city. And so you may get an HHS employee who gives you a vaccination. You may get a primary care physician, all sorts of folks who are participating.
Great, thanks. And maybe while I've still got you on the hot seat there, Bruce, seeing some questions around folks who might have been in what was the old priority 3, or maybe not in the category of some of the job classifications you identified. Is it safe that those folks proceed with their earlier dose, or what would be the direction that you would provide to those folks?
Right. So if you've received one of these emails or text and had your second dose rescheduled, certainly would welcome those who recognize that no, it's not. It wasn't meant for me. If you contact that public health line, they will rebook your second dose back to the original time frame. Again, in a way to be able to mobilize this as quickly as possible, the booking had the rescheduling had a date basis to it. And so with that date basis, what I'd really put the emphasis on is if you're in the eligible group and you don't receive the email, and you may not get it, or text, and you may not receive that email until the end of day today. If you have not received it by then please tomorrow call the phone number that we've provided to identify that you were missed and to have your second dose rescheduled.
Great, and as we kind of expected, vaccine is really a hotbed topic. And so to keep you there for a second, Bruce, just curious about staff that might have received their first dose elsewhere. What is the direction of these individuals, just as a bit of a reminder?
Yeah, so if you received your first dose in let's say in Halton or in another area, you do need to reach out to that particular jurisdiction and to discuss with them. They will have a process in place, again, for healthcare workers who meet this eligibility criteria for an accelerated second dose. And so they will be able to arrange for that to happen. if so, I'd encourage you to do that. Reach out. If you still have questions or concerns, then I'd send an email, and we can see if we can further assist.
Great, thank you so much, Bruce. Dominic, or maybe others, just seeing some questions around how we might or are capturing whether patients come in with vaccination and whether that's information that'll be important to capture. Just wondering if you have any comments around future vaccination understanding as we manage and provide best care to our patients.
Yeah, I see potential benefits, of course, if we were to collect the information on COVID vaccine status in patients on in a standardized manner. So if you're asking me, yes, I would like to have that. I would like to have that for any vaccine. And I mean, in the peds world, it's just normal to ask those questions. In the adult world, it's not necessarily the case. But to me, it would certainly make sense to ask that question and to have that built into our system that we can just check off was vaccinated or not. The issue might be, again, same as with staff, we cannot mandate for us to get that information. But if someone is willing to provide the information, I don't see a reason why we wouldn't collect it.
Fair enough. Thank you, Dominic. I'm cognizant of the time and do want to sort of make sure that we save some time for celebrations. Maybe if we could, anybody that has celebrations that they'd like to identify, add them into the chat. And then maybe Rob, you and I could piggyback off one another of answering those that come up. Or again, if anybody wants to come on camera and identify any, that would be great.
Yeah, Lucas, we had one right off the top from Elisa saying, in celebration of International Clinical Trials Day, kudos to all those who are involved in research, from staff to patients, with a special shout out to the amazing clinical trials department at JCC. So that's great.
Awesome. And then just reading through another one, just seeing thank you to our HR department and our HR leaders for an International HR Day. The team has gone above and beyond during the pandemic to help leaders and staffing navigate a new and complex world of work. We are very proud of the support behind the scenes to allow our healthcare professionals to focus on their important work. So a nudge to those who are celebrating International HR Day.
I see Patrice wants to do a live shout out.
Yes. Indeed. So thanks to Don Mallory from our HEADS team in answering those cybersecurity questions today, and also to the whole team led by Gary Rankin in keeping our HHS environment cyber safe. It's quite a challenge these days.
Thank you so much, Patrice. And just seeing there in the chat, May is Speech and Hearing Month. Thanks for all audiologists, speech and language pathologists, and CDAs. Thank you very much. And maybe I'll take a bit of time here, as people were so positive and some feedback to myself. I'd like to really recognize those that have been important in standing up the vaccine clinic, namely Carrie Lynn Meyer and Bill Butler, and many others, Brian Hirachuk, who without you, for sure, the clinic wouldn't be where it is today. So thank you for all of your support along the way.
Lucas, congratulations from Ellie to Jackie Cruz on her retirement on May 31st after many decades of outstanding contributions to HHS.
That's great. And see from Kelly Campbell acknowledging all those involved in the planning and implementation of the mobile health unit. Amazing team effort.
From Eric Ricker, thanks to the diagnostic imaging staff at LUMSI for all the hard work.
Great. And I'm not seeing any new ones popping up to the chat. Maybe just looking at the time there, Rob. Sure that we could maybe do our closing remarks and send people off on their day. I'm sure the time would be appreciated. So maybe I'll hand it back to you to do that and take us away.
Yeah, that's great. So we can give people a little bit of time back. There's one. I'll just say one more from Isabel Hayward. Thanks to Susan Pucciarelli, Les Gillies, Sharon Pearson, Peter Carla, Kelly Campbell for all the support. So thanks, Isabel. Very nice. Yeah, so we'll give, we can get back another 10 minutes that we didn't expect in our day. Look, I think lots to feel good about today, with numbers broadly heading in the right direction, which is great news. And weather warming up, which I think will also help to contribute to decreasing spread, but also increasing all of our mental health states, because just having some nicer weather is great. And of course, I know we're a 24/7, 365 operation, so there will be lots of folks who are working all weekend, but I know for those that can take advantage of this long weekend coming up, it's another great marker that we're headed into summer season, and holidays are a little more frequent. So all in all, I think we can leave today's meeting feeling pretty good about the direction that we're headed in, of course, never being complacent. So many thanks to Lucas for jumping in today. Lucas, I thought you did a great job. So fun to work with you, and thanks all for coming today. And I'll look forward to seeing you all again next week. Thank you.